As the nationwide epidemic of opioid abuse and overdose touches the city of Frederick, this administration is committed to being part of the solution in halting the illegal distribution of drugs and to help residents achieve recovery. The Frederick County Health Department and Frederick Police Department are two of the many local agencies leading efforts to look at the effects of and response to the rise of substance abuse disorder in our community. We're here with Barbara Brookmyer, Director of the Frederick County Health Department, and Frederick Police Chief Ed Hargis, to discuss what is happening and what can be done to recover from this public health crisis. Dr. Brookmyer, Chief, thank you for coming here to talk to us today about a really somber topic, the heroin opioid crisis that's really, nationwide, isn't it? And
right.
Sadly, Frederick is touched by it. What can you tell us about what's going on here and what we can do to help alleviate it?
Well, unfortunately, right now, this year in 2018, it's not getting any better than the past couple of years. We're still getting quite a few overdose calls on a regular basis where we're sending law enforcement personnel. The fire and rescue services are responding to those calls as well. We're treating the victims with naloxone. Majority, about 65% of the people that we come in contact with on an overdose are being transported to the hospital. And then that is triggering investigations both on where the heroin opioid substance came from. So we have the emergency response, and then we have the investigation follow-up.
And it's a challenge because you are a first responder, the police, the fire and rescue companies, and yet this is a health issue as well, and that's where the health department sort of rolls into this of how do we look at broader strategies of combating something that does not really show any signs of diminishing anytime soon.
Right, and I really appreciate your leadership in recognizing that it really is it's a public health issue. And so we certainly, as the chief had mentioned, have seen a rise in the last several years of fatal and non-fatal overdoses related to opioids and increasingly fentanyl, which is a synthetic opioid, has been responsible for a significant proportion of those deaths. Also concerning is the fact that now we're also seeing that fentanyl is also being added intentionally to cocaine. So we're also seeing overdose deaths that have related with that fentanyl and cocaine. And what we're hearing is that people thought they were getting pure cocaine and didn't realize that there was fentanyl in it as well.
There seems to be, I mean, what I've been able to observe is that you go through these cycles of drugs sort of peak and valley based on, I don't even know what drives it, markets and other kinds of things. Somehow this seems different than some of those other highs and lows of the kinds of drug issues that a community might undergo. Is it different?
I think it's different this time around because it's across all demographics, age group, race, male, female. So this time it is different, and the reaction from the law enforcement perspective is different as well. So while we're still doing the traditional enforcement component, we are also branching out into prevention and other avenues of community outreach to try to solve this problem and curtail it.
Yeah, and in fact, when we look at the data related to deaths anyway, that the average age is 35 and the average or the most common demographic feature is a white male for the overdose deaths. But if you were to ask me who's vulnerable, like the chief said, everyone is vulnerable to substance use disorder.
And when we have those community outreach components out in the community, we hear that we have to get to the children at a younger age and reaching out to the middle school level, because that seems to be where the interest starts heading in that direction. If a middle school person comes in contact with prescription medication, of course, there's only a limited supply at that age group to a prescription medication, and if they end up getting hooked on the opioid, then the easy branch over is to go out onto the street and look for heroin.
Are there techniques or issues that are making the problem worse and things that are making the problem better? What are you seeing from your areas of expertise of where these things actually are contributing to a greater issue and some things that are perhaps helping to resolve some of the problems?
I think from our end, what you're seeing is the illegal substances out on the street are at a higher purity level. So therefore, if you start with prescription medication, you go out on the street and you're getting a higher purity level of the actual substance that is causing a quicker addiction to it and a drive to continue on with it. And my guess is that it will be harder to recover from using that stronger substance.
Yeah, and I think related to that, so with the increased public awareness and knowledge that opioids and pain medicines, that they're all opiate containing medicines and fentanyl, so they're learning that they are pain medicines, or those pain medicines are opioids, and that the brain doesn't distinguish, is this a prescription medication that a doctor prescribed for a specific use and you happen to have taken too many unintentionally, or is this illicit use? And so the brain doesn't know that. So it's helpful now that more people are aware that when they are prescribed a medication and when they're having that conversation with their doctor, their dentist, or maybe even their veterinarian, that they're talking more informed and are asking, do I need this? How much do I need? Maybe I don't need it. Is it okay if I don't use the medicine? So it's definitely helped in that way in the prescribing environment. I'd also say that with more people talking about it, especially I noticed it right after we launched our www.takebackmylife.org campaign, that people were coming forward that had never talked to me about their personal or family or friends' use and their concerns, but so many people came forward and said, thank you so much for putting those videos out there. Can I share this? Because this is meaningful to me and it gives me hope, and I think it will give others hope. And so it's helping to reduce the stigma, because that's so, when we talk about what would I like to see in the future is, and ask people to do, people who are listening to this, is to try to not be as judgmental and try to have compassion for folks who are struggling with substance use disorder, because we do view it is a chronic condition, and relapses are not uncommon. And then also with treatment. So what is different now compared to, say, in the 60s, is that there's much more research that has been conducted, and in fact even more that's coming out each year, about what are effective treatments. Because unfortunately the research really lags behind what we really need. But there is research that medications can be quite effective, especially when combined with counseling. But there is still some significant stigma out there about the use of medications, even if it's a temporary use of medications, to give the brain a little bit of time to try to calm down so that folks can start working on the other things that will be necessary for them to be successful, such as getting jobs and building the relationships back up, and some other things that it's just helpful for them to not have that their brain constantly sending them signals saying, I want to use. So that's how medications can really be effective combined with counseling.
I imagine this is one of the challenges, though, from a law enforcement perspective, because someone has to want to go into these, you have to want to fix the problem before you can even start. And that's not where you work. You don't work in the recovery side, you work in the response side.
Right, so you have the response and the enforcement, but what we're doing now is through some grants that we received from the Governor's Office of Crime Control and Prevention, we've been able to hire a peer recovery specialist that works for the police department. It's assigned to the health department. So when we come across an overdose victim, if we do transport that individual to the hospital, the peer recovery specialist can come out and start talking to that individual right away. If the person doesn't get treatment out on the street and doesn't want to go to the hospital, we make that information available to the peer recovery specialist so they can come out the following day and start making contact and try to steer that individual towards treatment as well. So we're taking a different approach. We're not just responding to the emergency or looking at it from a criminal investigation aspect. We're looking at trying to prevent the next overdose down the line.
Is there any clear unmet need at this point that, in your professional opinions, you think would make a difference in stemming the tide or turning the tide a little bit?
Yes, I would say, I mean, so the peers, it's been terrific being able to have that working relationship that we do with the Frederick Police Department. So for those that aren't as familiar, I know that both of you are familiar with peer recovery specialists, but for those that aren't, they're individuals who have personal lived experience with substance use disorder. That can be they themselves, it could be a close family member, and have gone through training and have received certification to be a peer recovery specialist. And the research and our experience here with our peers working with the Frederick Police Department, working at the Frederick Memorial Hospital in the emergency department, working with the courts here, working with the Department of Social Services, with so many of our collaborating partners, we also see through that experience that our peers have been very successful in being able to relate to folks who are in active use in a way that is really quite effective, and we have excellent peers. So I think we're well positioned to do well, but we really could use many more peers because we're not able to offer the 24/7 service. And when you talk about the situations where people refuse transport, so say there's an emergency call, but either naloxone, Narcan has been administered and reversed the signs of the overdose right then and there, the individuals might then be deemed competent to make decisions themselves regarding medical care. So then they might say, no, I don't want to go to the hospital. So then if they're not at the hospital, then they're not going to have the opportunity to be connected to one of our peers. Now, sometimes the time to reach somebody is right then when others are there, but we're not resourced in a way to be able to provide that immediate response. I mean, we have in some cases, but there, as well as at the hospital, we're not able to provide the 24/7. And with the volume that we've seen, we would be able to provide even better one-on-one support to individuals if we had more peer recovery specialists. And then you mentioned early education. We could just talk on and on, but with young persons.
Certainly the community outreach last year in October of 2017, we did Alyssa's story. So we had Alyssa's mother come and do a presentation. We opened it up to the community. It was done at Frederick County Community College. And we did that to spread the word on the story of Alyssa. She was a young female teenager who started using pills and then turned over to heroin and went through several rehabilitation cycles, but unfortunately eventually overdosed and turned into be a fatal overdose. But Alyssa's mom comes out and actually gives the whole story, and it presents it from a different view of, I'm the family member, I love my daughter, I wanted the best for her, but it didn't end up that way. So that's a very impactful way of reaching out to the community, that, you know, just by having a police officer in front of a classroom speaking, that gives one direction, but this was a whole new approach to some community college students were there, and it was targeted at that age group where this is happening.
What was the program you mentioned that you said people found so helpful?
So we had a social media campaign,
Yes.
www.takebackmylife.org,
Yes.
and we're actually doing a refresh of that. And then we also have, for younger persons, a campaign that is targeted towards them, Stay in the Know.
And for people who might be wanting help right this minute with a problem either of their own or with a loved one, what would be the best number to call or place to go?
So I'd say 211, the 211 hotline,
211.
which is available 24/7. It has the mental health crisis support, some suicide line support. There is a separate number for that, but if people can call 211 if they're in distress or if they're not sure, what types of services they might want. It's a good general number. During regular business hours, we also can have people call the health department if they know for sure that substance use disorder. But the mental health 211, which is run by the Mental Health Association, is equipped to be able to help people sort through mental health, substance use disorder, and in a crisis situation.
And obviously, if they come across an individual or a family member that they believe is actually under the influence of an opioid and they're in danger, to call 911 as soon as possible. And
Right.
that would trigger a response both from the police department and fire and rescue services.
Yes, and after they've done that, then we'd strongly encourage them to contact the health department to get trained in the administration of naloxone. People also don't need to be trained, so that's when you ask what's new in the last several years. Now people who want to be able to access naloxone or Narcan, the medication that reverses the effects of opiates, people can go to a pharmacy and they can buy it without a physician's prescription because the state secretary or deputy secretary of health has technically written the prescription. So people can go to the pharmacies if they're concerned that because of somebody who might be in their house, someone in their neighborhood, somebody at their workplace, somebody in their entertainment activities that they do, whatever someone's interest is or concern is, they can get the naloxone without a prescription. Some insurance companies will cover it. Some there's more of a copay, but we encourage, but if people, if finances are a barrier, they can come to the health department, and through our training we provide the medication, and it's a simple nasal spray. So for people who are a little squeamish about anything medical, the Good Samaritan Act, the state act, covers people for liability concerns if they administer it and, say, some people might say, well, how do I know if the person's unconscious and it's due to a drug overdose and due specifically to an opioid overdose? It doesn't matter. The Good Samaritan Act will cover you, and the great thing about this medication is that you wouldn't expect any side effects. So even if it's a child, if it's a woman who's pregnant, the medication is safe and effective if it's due to an opiate.
It's a conversation I wish we didn't have to have, but I think it's really important that we continue to have the conversation whenever possible, because until the problem goes away, we need to keep talking about it and pull the community resources together in order to deal with it.
Thank you for giving us some information that's helpful to work with and information that we need to keep updating.
You're welcome. Thank you. Can I
Thank you
give
for
one
having us.
more plug?
Yes.
Sorry, there's always so much more to say. But so what individuals can do right now, if they have any medications in their house, that they might be saving for a rainy day or in case they get an injury, we encourage them to safely dispose of them now. Medicine cabinet for those that do have an ongoing need for pain medicines, anxiety medicines, medicines that have an effect on the brain. The medicine cabinet isn't the best place for that. One, medicine cabinets are in bathrooms where there's moisture. That's not good for medicines. They should really put it in a secure place. And when they're done with them, effectively dispose of them. And we have that great.
And just to go along with that, the Frederick Police Department partners with the Health Department as well as the Drug Enforcement Agency, and twice a year we do a drug take back, and it's done in October and April of every year. We're actually looking at doing it in different areas of the city, so that's an opportunity for anybody to dispose of medication that they have in those medicine cabinets that they no longer need, and we encourage them to bring it out and dispose of it. We also have a drug take-back box at the Law Enforcement Center out by the airport, and in the near future we'll be getting our drug take-back box back at police headquarters in the back lot.
And perhaps a reminder that people should not flush them into a toilet.
No,
Correct.
please don't. For
Very
the
bad for
health
the
of our
water
wastewater
supply.
and water supply.
Right. So not everyone might have that message. So, well, thank you for this helpful information, and we will look forward to having you back to hope that we have good news to report.
I certainly hope
Thank
so.
you.
Thank you. Thank you. Right.
Good information. Good
Very
overview.
informative.
Thank you. I mean, I really appreciate you letting us talk about the public health part, and Chief has just been terrific, and
It's a good partnership across the board, and hopefully we keep getting funding or even more funding for another peer recovery specialist and expand that.